So my name is Erica Takada, and I am the Executive Director of the Public Health Institute Center for Wellness and Nutrition. We are a partner of this campaign, and I'm here with my webinar team, which includes my co-PI, Dr. Michael Rodriguez. Thanks for joining us. And my team who will help guide you through this webinar today. You'll see Emily McClintock, Cassie Chandler, Jeanette Hughes, Coy Mitchell, and also Moran, who will be helping me to go through the budget guidelines later today. You will hear from each of them, but before we go on, I would like to introduce Ana Bolaños. She is the Assistant Deputy Director of the California Department of Public Health's Office of Health Equity, and she would like to welcome you all. So Ana, I'm going to hand it over to you.
Great, thank you so much, and thank you for your patience as we've lost contact a few times. As I've been introduced already, I'm Ana Bolaños, serve as the Assistant Deputy Director with the Office of Health Equity with the California Department of Public Health. And I also serve as the Project Director for the Child Youth Behavioral Health Initiative at the Office of Health Equity. And this is for the public education and change campaigns. My pronouns are she, her, and ella. And I reside in the ancestral homeland of the Nisnan, Maidu, and Miwok peoples here in the Sacramento Valley. And this is really an exciting time. We at OHE decided that we wanted to do what we consider a statewide public education campaign. We referred it to as the macro campaign. And these are what we refer to as community level campaigns. So today, in partnership with the Public Health Institute Center for Wellness and Nutrition, we are really excited to provide this informational webinar to provide community-based and tribe organizations with a tremendous opportunity to learn about the local level public education and change campaigns. We acknowledge the significance of community-driven local delivery and addressing stigma with priority populations. You'll learn more about this from PHI. The CDPH OHE aims to reshape behavioral health through youth-centered, co-created public education and health campaigns by partnering with you, our CBOs, and tribal organizations. Thank you for your interest, engagement, and enthusiasm. I look forward to connecting with you more in the future. Back to you, Erica.
Thank you, Ana. And Jill, you can advance the slide. What I'm going to do now is to quickly just go through the agenda. This is the agenda for our time together. We're at the welcome and introductions. I will provide a quick overview of the local level campaign and how that fits into the bigger picture of the Children and Youth Behavioral Health Initiative. And then Cassie will do an overview, walk everybody through the RFA. And we'll also have a demonstration of the portal during that time. We'll also have some time for Q&A and do a wrap up with some reminders of key dates. If you can go to the next slide. Just a couple of housekeeping items for today. So if you can please submit all questions using the Q&A function. So you'll see that at the bottom of the screen. So not using the chat, but if you can please use the Q&A, that will be great. We're going to pull all the questions from there so that we can also post them. You can also do the raising hand function during the Q&A portion of the webinar today. And you'll also see that at the bottom of the screen. It says raise hand. And just a reminder that this webinar is being recorded and it will be posted online, and we will post it within 3 business days of today. And in addition to that, we will also be posting a document with all of the questions and answers. And that will be an ongoing updated document as we get more questions from other potential applicants. So with that, let's keep going. So why are we here today? So the purpose of today, as you may have guessed, is really to provide comprehensive information about this opportunity through the California Department of Public Health's Office of Health Equity, as Ana introduced. and more specifically, the Children and Youth Behavioral Health Initiative Local Level Public Education and Change Campaign, RFA. And the other purpose is to address questions from potential applicants. And our desired outcome for today is that all of you will have a clear understanding of the RFA opportunity and process. Now, while we're on this slide, I also want to remind you all that we will, and I will review this again, we will review this throughout the webinar, that following this webinar, there will be office hours made available to you. Later on, we'll provide more details about that. But during this call, we will walk through the RFA, the portal, the application portal, and a recording of this will be posted, as I said. We want everyone to feel comfortable and welcome to participate in this RFA process. And also please know that all questions are welcome. We just want to make sure that you know that we understand that everyone who's on this call and who also wants to participate in this RFA process and opportunity may have different levels of capacity in regards to understanding of the topic area or an RFA process. So all questions are welcome, and all questions that come to us will be answered, maybe not today, but they will be addressed and posted so that everyone has the opportunity to see these questions and answers. So with that, let's keep moving. Thanks. So very briefly, I will go through a high-level overview of the Children and Youth Behavioral Health Initiative to provide some context for the local level campaign opportunity so that you can see how this work will fit into the bigger picture of the initiative. So next slide, please. So CYBHI, or the Children and Youth Behavioral Health Initiative, a little background on that. So the goal for the Children and Youth Behavioral Health Initiative is to reimagine systems that support behavioral health and wellness for California's children and youth and their caregivers and family. And when this Children and Youth Behavioral Health Initiative was conceived, the vision was that there would be an innovative ecosystem that would focus on well-being, the prevention of behavioral health challenges. There would be routine screening made available and that's accessible, supporting and serving all children and youth for emerging and existing mental health and substance use needs. It was designed and implemented with the California Health and Human Services departments, so really multiple stakeholders, education stakeholders from early childhood education through K-12 through higher education, so the entire spectrum of what's being defined as children and youth, other state agencies, experts, community partners, children, youth, and their families. Next slide, please. And this is a visual that kind of shows you how the CYBHI is organized. So a little bit of background: in July of 2021, the California state budget was passed, and in that budget was the Children and Youth Behavioral Health Initiative. So it was huge that it was both included in the budget and also passed. And so initially, the focus for this is on 11 components across 4 themes. And that's what you see in the visual here. You'll see the 4 theme areas, and under each of those are the different streams of work, and they total 11 different streams of work that's happening. All these 11 streams of work will be addressed by various departments and agencies, including the Department of Healthcare Access and Information, the Department of Managed Healthcare, the California Department of Public Health, and the Office of Surgeon General, and many other partners and experts. And you'll see, and just so you know, this is a continuously evolving list. So, this is what was conceived at the start, but things can change over time. And you'll see that the local level campaign that we're focusing on today is in theme area 3. So that's the area that is highlighted in red, and very specifically that first stream that says to conduct culturally and linguistically appropriate campaigns to educate the public and raise behavioral health literacy, as Anna explained to you in her introduction in the welcome. It's important to note, and it's also great to see that we're not working in isolation, and that at the California Department of Public Health's Office of Health Equity is responsible for the public awareness and change campaign aspect of the entire Children and Youth Behavioral Health Initiative. So at this point, Jill, I'm going to share my screen. I do want to share a visual here. And this is what is known as, this was developed for the Public Education and Change Campaign, and it's known as the causal pathway. You may also see this as a theory of change, which is, and there are a lot of words, so I'm just going to quickly go through this with you, and this document will be made available to you as a resource. But what I wanted to quickly point out is in the Public Education and Change Campaign's tranche of work that the Office of Health Equity is responsible for, there are 2 work streams of that. There's this larger statewide campaign, which will be overseen by an agency. And then there's the local level campaign. And this is what we're talking about here today. It's also important to note that this isn't just being done in a vacuum. There are advisors that includes a youth collab, which is comprised of youth who are going to provide thought partnership and co-design, and that thought partnership is both for the statewide and local level campaigns. And there's also a brain trust of national and international experts in the area. So for the statewide campaign, you can see how there's going to be a development process and a launch process as well. But I'm going to focus here on the local level because so in parallel to the statewide campaign, we're going to be focusing our work here with those of you who are awarded grants, that starts with kind of a research and planning and design process here in these first box areas. This is going to be the development part. So CBOs and tribal organization entities partner with children, youth, and caregivers to co-design the local level campaign. So this is really the campaign development area. And you can see how it's really important that children, youth, and caregivers provide feedback so that it's an iterative process. And so this is really talking about the local children, youth, and caregivers who provide that feedback. And from there, the aim is to target the 5 priority populations, which we will talk about more specifically. Each CBO will have a spokesperson to be able to talk about their campaign and have campaign talking points. And then these are the areas that we're all hoping that these local level campaigns can target. And Anna mentioned that as well, which is the destigmatization of behavioral health and mental health challenges, as well as the knowledge of services that are available. And so those are in these 5 boxes here. And ultimately, with the desired outcome that's on the very far right side of this, this causal pathway or theory of change. So I'm going to leave this up here for a couple of extra seconds here. But you can see that desired outcomes are increase in knowledge of available services, increase in confidence that children can get support that they need, and then increase in children who actually receive the services and a decrease in stigmatizing attitudes toward behavioral health. And then I think it's also important to note that for the statewide campaign, there are going to be general messages that address services and destigmatization. But at the local level, we're really hoping that you can get at the cultural aspects or the language aspects or the medium and approach aspects that are specific to the 5 target and priority populations. All right, so and again, this will be made available as a resource for all of you. I am going to stop my sharing, and Jill, if we can get back to the slides, that would be great. So you can advance to the next slide, please. So the local level campaign overview, I talked about the priority populations. So this slide names the audience and the priority populations. So children and youth, which is ages 0 to 25 for this campaign. Parents and caregivers and families who are part of the communities that are historically unserved, underserved, and inappropriately served, and the 5 priority populations, which you can see listed there. And I'm going to go through this quickly because when Cassie walks through the RFA, she'll have more information about all of this. So we can advance to the next slide. And this is more information about the local level campaign specifically. So that it's going to strategically focus on priority population and communities throughout California and be delivered at the community level, which is aimed at reducing stigma, as I said. So the key there is being delivered at the community level. And then recognizing that second point there, what's really important, and Cassie will go over this, is that the selected organizations will develop their own local level campaigns that will be youth-centered, co-created public health campaigns. And it can be a number of things. So you can see that. And selected CBOs will also receive technical assistance and capacity building resources throughout the grant period. And the third bullet is just talking about where we are now, which is all of the CBOs being invited to apply to this RFA. All right, let's keep going. And this is just a general timeline of how this might be operationalized. You'll see here that we're at this point here of the RFA process. We're hoping to kick off in March of 2024. In April, we'll have our first learning lab or technical assistance session. The first grantee reporting will be in July of 2024, and we're aiming to have our first annual in-person convening of all the selected CBOs, along with partners, in the fall of 2024. And you'll see here, these 5 boxes are the ongoing annual activities. So I talked about the testing and share and learning labs, grantee check-ins, partner check-ins and collaboration, annual convenings, and grantee reporting. And all of that will happen as you are developing your campaigns and delivering them into the communities. And next slide. Let's go through this quick. Just key overview of just the key points. So I talked about who the lead is, which is CDPH Office of Health Equity. The initiative is the Children and Youth Behavioral Health Initiative. The project we're talking about today is the Local Level Public Education and Change Campaign. The funding for that is up to $25 million to be granted to 25 to 30 CBOs and tribal organizations. The performance period will be March 1st, 2024 through May 31st, 2026. And CDPH OHE is partnering with us, PHI, to oversee the local level campaign. So with that, I am going to hand it off to my colleague, Cassie, who will take you through the RFA itself and provide more details on some of what I mentioned. And again, this is being recorded and it will be posted, and there will be office hours. So Cassie, I'm going to hand it over to you.
Great, thanks, Erica, and hi, everyone. Jill, if you can move to the next slide and then the one after that. Perfect. So before I dive into the RFA, I'd like to highlight some of the key points. So first, CDPH OHE is seeking to fund 25 to 30 501c3 community-based organizations or CBOs, tribal organizations, or collaborative partnerships. All CBOs must serve and have an office in California. A mandatory non-binding letter of intent or LOI is to be submitted online by December 18th at 5 p.m. And I'll talk a little bit more about that. Probably most importantly, applications are accepted online only and by January 16th, 2024 at 2 p.m. Pacific time. Total amount awarded will be a maximum of up to $1 million per award. However, note that awardees are not required to request maximum funding. Funding requests should really match the work plan proposed. And finally, as mentioned, period of performance, March 1st, 2024 through May 31st, 2026. Great, now I'm going to share my screen and introduce you to the RFA. Let's see here. Okay. So I'll turn my attention over here, but yeah, it's important that you read this thoroughly on your own, but I'll just provide a high-level walkthrough, and please do note any questions that pop up, and today and over the coming weeks we'll do our best to answer them. So here we are. Here's the RFA, and I'll just kind of move quickly through it, but table of contents so you can find if there are sections you would like to read specifically or refer back to. Just the introduction, finding purpose, and background. Erica talked a little bit about this, but I encourage you to read more about the background as well as the overarching initiative, and also CDPH OHE and CYBHI and the goals. Just again, for a little bit more background and context. And here are some websites, both OHE's website as well as the CYBHI website, and you can get more information than is even here on this RFA, just to see what others are doing. And Erica talked a little bit about the other work streams. So yeah, so diving into this, the CDPH OHE's Youth and Caregiver Co-Design Public Education and Change campaigns will focus on reducing stigma, increasing awareness, and increasing help-seeking behavior. The CDPH is overseeing the public education and change campaign initiative and is guided by the following values: advancing equity, designing for youth, by youth, centering children and youth, empowering caregivers and communities, and stigma reduction. We mentioned the priority populations, but I will also list them out here because this is important to keep in mind. African Americans, Black, Native Americans, Asian and Pacific Islanders, Latinos, and lesbian, gay, bisexual, transgender, queer, and questioning communities, with special consideration for transitional age youth, persons with disabilities, justice, and foster care involved youth, and those living in rural areas. So a little more about the local level campaigns and funding opportunity. Again, 25 to 30 CBOs, and good job if you're on here now. Today is the informational webinar, December 12th, but as mentioned, it's being recorded, so others who weren't able to join can still listen. And then we do have 2 office hours, December 14th and January 5th, and a little bit later we'll talk about those in a bit more detail. Eligibility criteria. This is important to know. Organizations must have an office physically located in California, must provide services in California, must be a 501c3 CBO or tribal organization or collaborative partnership where there is one prime applicant that is a 501c3 CBO or tribal organization, and partners are also CBOs and tribal organizations. Must have demonstrated experience partnering with children and youth from one or more of the priority populations mentioned. And finally, organizations and their partners must be inclusive and shall not discriminate. The description of the scope of work, I encourage you to read this in more detail, but the local campaigns will strategically focus on priority populations and communities throughout California and be delivered at the community level. So that's really key and aimed at reducing stigma, enhancing behavioral health literacy for children, youth, families, and communities, and increasing health-seeking behavior and wellness support. Recognizing the importance of local delivery designed for and by the community is really important. And activities should aim to be dependent on input from the community. So really community-centric. There will be a planning, designing, and development period followed by implementation, delivery of campaign in the community. Evaluation and learning will also be a key component for each participating organization. So the grant will include several resource activities for each of the organization, and participation and engagement is expected. So this includes approximately 9 virtual testing, sharing, and learning labs annually, regular check-ins with PHI staff or technical assistance to address individual questions, annual in-person convening for learning, sharing, and networking, site visits by the CDPH, OHE, and PHI staff to be hosted by CBOs, and a final in-person showcase convening at the end of the grant period. So funding information, budget and budget justification. A little later, my colleague Moran will go through the budget template, so I won't get too detailed here. Total award amount, as you know, is up to $1 million per award. Note what will not be funded: debt retirement, purchase of properties or capital, partisan activities, operational deficits, or directly or indirect purchase, prescribe or provide marijuana or treatment using marijuana, including THC and CBD related items. Geographic consideration, I think we covered that, but in California, so local level campaign activities in communities throughout California. Project timeline, once again, March 1st, 2024 through May 31st, 2026. So approximately 27 months. Reporting requirements, so there will be 3 progress reports, 3 financial reports, and 2 kind of annual program and evaluation reports. Selection and evaluation criteria. So the letter of intent that I mentioned can be electronically submitted through the online portal, and this needs to be done by December 18th, 5 p.m. Pacific time. And it's a pretty simple LOI, so name of lead, location of lead, priority population, and type of local campaign, if known. And then we'll get into here the kind of narrative summary for the application. So first, you'll talk about your organization. So just describe the organization and experience, why your organization is appropriate and qualified to develop a local youth-centered campaign to address stigma and promote behavioral and mental health help-seeking solutions. So it's important to talk about your track record of engaging with the community, engaging with children, youth, and their families, history of addressing mental, emotional, and behavioral health with children and youth, history of working at the policy systems and environmental change levels, in addition to service delivery, demonstrate commitment to social justice, youth development using an asset-based approach. Next part within the narrative, intended audience and need, an issue to be addressed. So really, talking about your priority population, a brief description of the needs and issues to be addressed, and, very importantly, an explanation of how youth will be engaged in the development of the local campaign. Your local campaign approach, again, how it will be youth-centered and engaged, and a few things to think about. A campaign development approach guided by principles of equity that recognizes the need to strive for health and racial equity, culturally responsive and linguistically appropriate, participatory youth and community engagement plan, and plans for the sustainability of that local campaign. In addition to this, within the narrative, there will be a 9-month work plan template, which I will talk about in just a moment here. Your project goals, so specify short and long-term goals for the local campaigns. Also, organizational capacity and qualifications of staff, evaluation, describe your organization's process, outcome, and impact evaluation strategies, including how you would analyze or determine the effectiveness. A few other requirements to keep in mind. You will need executive support for the proposed project. So, for example, a signed letter of support from a senior level staff, demonstrating willingness to commit staff time and resources to develop and implement a local campaign. Names and contact information for 2 references outside of your organization who are familiar with your work. And then affirming participation in the annual and in-person convenings, as well as the learning and evaluation activities. And finally, affirm ability to submit program and financial progress reports as outlined in this RFA. So moving on to review and scoring criteria, you can see here, so there's a total of 100 points in the narrative summary, which I just talked about, the kind of key components within that. You can see each are worth 5 points for a total of 40 points for the narrative summary, 15 points for evaluation, 15 for budget and budget narrative, 20 for your preliminary 9-month work plan, and 10 for overall capacity. And then looking at the application timeline, here we are on the 12th. So in 2 more days, we'll have the first office hours. The letter of intent will be due in 6 days on December 18th at 5 p.m. Pacific time. And again, this is mandatory and non-binding. The second office hours will be offered January 5th. And very importantly, to keep in mind, the RFA deadline through the online portal is or will be January 16th, 2024 by 2 p.m. Pacific time. And then award notification probably early to mid-February. Additional guidance, I think you all can read through this. I think it's important to remember you can check the RFA posting website for updates, changes, corrections, and written Q&As. And again, applicants are not required to request the maximum funding allowed, and funding amount requested should really be commensurate with the work plan that you're proposing. Moving down, application checklist, so just kind of look and see what you've got and slowly check off. You can also see there are links to the letter of intent online as well as the online application. And then I'll just very briefly go through the appendices. So in terms of what this looks like online, here's sort of an example of the application, a hard copy. So organization information, project information, geography, population, and then the narrative summary. So these different points that make up or components that make up the narrative summary, evaluation, required participation in sort of affirming those different things, any technical assistance needs, and then there will be several upload attachments and uploads that you'll want to be sure to include. Yeah, as I said, Moran will go through the budget worksheets, but these are available online in PDF or Excel. And so there are budget worksheets as well as a budget justification. And then there's also a 9-month work plan. And, you know, as you can see, it looks like a pretty standard work plan: tasks, activities, staff responsible, timeline, measure progress, deliverable. And this is really for to really see what you're thinking in terms of how you would hit the ground running, and you know what you're thinking and how you'd start out and sort of your process. So that's the purpose of this. And this will be available on Word and as a PDF online. And then Appendix 4 glossary, so just something that you can look back at. So perhaps this listed a lot of questions, but there will be opportunities to answer those questions a little bit later. I'll stop sharing and pass it over to my colleague Coy, who is going to lead us through the portal, the online portal. Thanks.
Thank you. So just before I get started, the link to the portal is in the answer section under the Q&A tab. So feel free to follow along that way if you would like. Okay, so when you are you know, interested in submitting your LOI and interested in you know, submitting your information, this is the website that you will go to. It just gives a bit of background about the application. And once you scroll all the way to the bottom, you will see a link here for the online portal, which will take you to the actual application. So once you click that, you select, it will take you here. And from here, you will be able to submit an LOI. You just click submit, and then it will take you to this page here where you will be able to sign up for the website. You'll just insert your email, confirm your email, select the password. There aren't many restrictions for the password, so something very simple will suffice. Your first and last name, and then you'll select sign up. After that, it will prompt you to verify your email. When it prompts you to do so, if you cannot find it in your email, you will just select this button right here. And if you already verified, you just select proceed to form. So you'll go to your email and you'll receive a notification that is similar to this right here. Out of that. Oops. Yes. So I highly suggest utilizing a browser of some sort in order to open your email, because you will want to select this button, but it's hard to see if you're using Outlook and you're using the Outlook app, just programming glitches that happen. But you will also be able to copy this link here if you do run into that issue. But to avoid it, like I said, just use your browser. Once you click confirm your email, it will take you to this page where you'll see that your email has been verified. From there, you will finally have access to Submittable. You'll just enter the email that you entered when you signed up, as well as the password, and just sign in. After you sign in, you'll be taken to this page. From here, you'll select letter of intent, where you'll be able to submit your letter of intent. So you'll select continue here. And then from there, you just go through the application process. And you just fill out each prompt as it relates to your organization. And then finally, you'll select submit. Once you submit your LOI, you'll receive this confirmation page, and then we will send you an update via email. The email will look similar to this. It will simply thank you for submitting your LOI, and let you know that you could follow up with us at this email if you have any questions or concerns. If your LOI is accepted, well, once you submit it, it will say received, but if it's accepted, this will change to approved or accepted. You'll know the status once you see it. But we will also send you an email stating here if your LOI was accepted and you were selected to go on to the next stage. And then here you will have the opportunity to do so by selecting this link here, or you could just simply log into your account. So before it's accepted, you'll go to Forms under your account, and you'll see that your letter of intent has been submitted. Once you refresh this page, you will then see that you have access to the application. Once you receive access to the application, you select Open. And from there, you will be able to actually complete the application. And just like the LOI form, you'll be able to just fill it out as it pertains to your organization. There are quite a few fields, but they're very simple to follow. Those with stars next to it are mandatory to fill out in order to submit the application. So once you complete everything, you'll select submit form, and then from there you will be all set. You'll finally receive a follow-up email from us stating that the form was sent, and then from there you'll hear from us again for confirmation if you have been selected to be rewarded or not. Thank you. Do we have any questions about the portal?
Thanks, Coy. We'll take the questions during the Q&A, or if you have any, just please submit them through the Q&A function. So thank you, Coy. Now what I'd like to do is talk a little bit about the budget guidelines. It's again, I can't give any tips as far as how you're going to budget your project. What I'm really going to do is just go through the budget template along with my colleague Moran, who is the actual budget expert. So what I'm going to do is display the template and the budget justification as well. And then I will talk a little bit about the budget worksheet tool that we would like to make available to all of you. So, Jill, I'm going to share my screen. And let me make sure I can find the right document. Okay, let's start with the budget template. And let me see if I can make this a little bit bigger. So you'll see a version of this in the RFA document itself as an appendix, but we will provide links to this budget template. It'll be in both Word and PDF form for you to complete. So it'll be available for download, and then you can upload it to your application. to your application as an attachment. So you'll see those links, and all those links will be made available for the application before the end of the week. And those links will also be in the application that Coy just walked you through. So there will be multiple places for you to be able to access this template. Excuse me. A couple of things to note about the template. So it covers all the entire performance period of this grant. So that's 27 months from March 1st, 2024 through May 31st of 2026. And we're calling them years 1 through 3. So just note that, so there will be a budget table for each year. So this is year 1, and you just note that we're calling it year 1, but this is a partial year of 4 months to align with the state fiscal year. So this first one is March 1st, 2024 through June 30th, 2024, which is the end of the state fiscal year. So I'm just going to walk through the different components. So you'll see we have a place for you to name the staff. So the name and position will go here, the salary, the FTE, and then the number of months for this first year, and it'll calculate your total budget. I will just say that for these different components, we will provide a spreadsheet worksheet, so an Excel spreadsheet that will help you calculate all of these to make it easier. And then you can choose to either upload that, you can save it and either choose to upload that spreadsheet, or if it works better for you, you can transfer that information to this template and upload it that way. So just wanted to let you know that we will make an Excel tool available to you that will make it a little bit easier to help you calculate a lot of these. For example, if you have the salary and your percent FTE, it'll calculate the year 1 of the first year, which is just 4 months, and have the budget and the subtotals calculate. So this is this is the component for the salary and the wages, then the fringe. And we have the formulas in here so that you see how we're considering, salary times fringe. So this subtotal will go here, and then it'll calculate based on what the percent fringe is for your organization. For travel, we're asking you to please include, so as you know, we will have annual convenings. And so you must list your travel to the convening here in the travel area. And then you also need to make sure that your travel budget adheres to the California travel rates. And we have a link provided here so that you can look at what that is. Please be sure to factor in, depending on where you're traveling from and to, airfare, hotel, per diem, ground transportation, mileage, and total, and that should be your total budget for travel. And we are asking that you travel to these annual convenings with, so at least 2 people from your team should be traveling to this. We have an area for office and campaign materials and supplies here. And other expenses such as printing, communications, consultants, stipends for youth, incentives for maybe you're doing focus groups or something like that. So other expenses should go in this area. And then there's the total direct expense. So that should calculate, and that includes salaries and salary and wages. Everything above here, these are all your direct expenses, and that should total here. You have total indirect. So if your organization has an indirect, it is not to exceed 20%, and that goes here. And both of these calculated together the total direct and total indirect will be your total budget. And so we have a table like this for each year. So again, year 1 is a partial year of 4 months. Year 2 is 12 months. So that's July 1st, 2024 through June 30th, 2025. And then year 3, which is 11 months. And that's July 1st, 2025 through May 31st, 2026. And we ended it in May 31st, 2026, so that it gives you 30 days for reporting. So I know this is not a budget thing, but in case you're wondering why this third year ends May 31st, 2026, that is the reason why. And so same formulas, same table for each year. The only difference is the number of months that are calculated in the salary and wages and the total number of months to consider for your budget. So those months will be pre-populated in this column and this column of 12 months and this column of 4 months. Moran, did I miss anything? No. Okay, thanks. And now I'm going to share very quickly the budget justification form, which we also have. So I'm going to stop my share for just a second, and I will pull up the budget justification form. Okay, so in the RFA appendices, you'll also see a budget justification. Again, you will have a link to this will be made available to you for you to download so that you can upload it as an attachment to your application. But this basically follows the budget template. And for those of you who've done many grants, which I'm sure you have, you're familiar with budget justifications. So the budget justification starts with personnel costs. So basically what we would like for you to do is enter costs for year 1, and it's a form, so you can just tap it and enter it for year 2 and year 3, and then just list the personnel and what the total amounts are for years 1, 2, and 3. And then here you'll be able to also talk about how your staff will be working on your project. And so you'll be able to enter that information here, and you just click right onto it. The next section will be fringe benefits. And then again, you're just going to include the totals for years 1, 2, and 3. And you can click here to talk about what your fringe benefits include. And then same thing for travel. And this here, it talks about the travel that is required for this, the campaign, the local level campaign. And then you can enter here for the narrative of your budget justification. Similarly for the office and campaign materials and supplies. So everything will be clickable. And you enter your narrative here, and then other expenses. And then here, just a summary of your total direct and indirect costs for years 1, 2, and 3, and that'll just come right off of your template and spreadsheet that you may choose to use if you would like. And then again, this is a total summary for years 1, 2, and 3. On the final page. So that is what the budget justification form is like. Moran, anything to add?
No, not at this time.
Okay. Thanks, Moran. All right, so I think that takes us through the overview of the RFA. So I'm going to stop sharing my screen here, and I'm going to pass it over to my colleague Jeanette, who will take us through and facilitate a Q&A. So Jeanette, and also Emily, who is monitoring the Q&A function.
Good afternoon, everyone. Now that we have spent a good amount of time going through a couple of things, we are going to handle our Q&A right now. So first, I'll address the questions that have already been answered, just in case someone's not looking at that particular Q&A section, just so you know we have handled a few, and then we'll go through the ones that we can, and anything that we cannot answer today will be added to the Q&A document that will be uploaded to the website and will be in a running Q&A document in case anything pops up between now and the time that it's due. It will be consistently updated. So yes.
I was just going to say, I'll add that anything you go over right now will also be included in that Q&A document. So if you miss something while Jeanette's going through it, it'll still be available there.
You're correct, Emily. Thank you. So the first couple of questions that have been answered, the RFQ link is in the Q&A chat box. You have access to that. We had a question on where do we register for the email list concerning this project. The link for the website has been submitted for that. It says, can we have one target population, either youth or caregivers, or is the project mainly seeking to engage primarily youth? We have an answer for that one.
And I think, Erica, you answered
Erica, yeah.
one. Would you be willing to come off mute and respond to that out loud?
Yeah, I mean, I think that the answer to this, that's actually a really good question. This campaign really is targeting and aimed at engaging children and youth, and then also reaching caregivers, but it's primarily centered on children and youth. There's not a clear, I don't think that we're looking for a campaign that necessarily specifically targets the caregivers, but information that helps caregivers to support children and youth is kind of what we're looking at for this campaign. So, and I just want to say while I'm here too, that we may not be able to answer all of the questions that are here. We do want to be able to make sure that we're being accurate with our answers. So all of the questions that are posted, even if we're responding to some of them here, we will have the answers, the questions and the answers, all of them posted online, posted on the website as well. So, so in some cases, we may say we're going to confer with the entire group and post the answer. So just wanted to be clear about that and transparent.
Thank you, Erica. We've got the the online portal link has also been posted. If anyone needs that, that's where you submit your application and your letter of intent. We also have a question about the specific age group that is from 0 to 25 is the age group concerning youth. And then we have a question about office hours. We do have office hours scheduled for December 14th. The link to schedule your office hour time is in the chat. There will also be a link coming forth concerning the January date. Right now, we just have the December date set up. It's also going to be posted on the website, so you'll have more than one way. And there's a question about local level or state level. This RFA is for local level projects. And then the last question about advertising. You're not expected to hire an advertising agency for this particular work. So a couple of questions that I know that we can definitely get through. So there's a question about, is there a location that the public can learn about and weigh in on this statewide campaign effort? The Office of Health Equity Advisory Committee, and are there any events or venues? So would anybody from OHE like to come off and kind of give this answer? Or is there an opportunity for the public to learn and weigh in about this statewide campaign?
Good afternoon. My name is Johnny Gilbreth. Yes, there's always opportunity for public to weigh in on our statewide campaign efforts. We know that this particular request for application is focused on local level campaign efforts, but we are happy to have our public-facing email address added to this webinar so that you may be able to submit questions as needed.
Thank you, Janine. We can definitely add that answer to that question and get it out to the group. If you could put the email address in the chat for me, Janine, we'll make sure to put that answer in here so that everyone can see that. It says, where are the assurances that CBOs that specialize in serving each of the priority populations will be awarded, or how will CDPH ensure that all the priority populations will be adequately served? At this time, we do not have an answer for that question, but we will convene with CDPH and definitely get that question answered for you. There's a version of the template available. Yes, there will be an Excel version of the templates, especially the budget templates available and the work plan templates available, and that will be downloadable on the websites. Can this opportunity fund existing work? We will get an answer to that. That's a really good question, and we'll definitely make sure that one is answered as well. So how is the outreach campaign expected to roll out? Will the Office of Health Equity provide a contractor to execute the local level campaign, or should we budget to deliver the campaign? The RFA stipulates that you'll develop and deliver. And I think I hear Erica coming off mute to answer this one.
Yes. So
Thank you.
yes, part of your work will also be to deliver the campaign because you would be the expert in how to best deliver the campaign that you design. So if in the RFA, we do explain that the local level campaign can be so many different things. And you would be the experts on what that thing is and how it can be effectively delivered to the population that you choose to target. So it is about, so you should budget to deliver the campaign as well.
Thank you, Erica. Can projects include or target more than one priority population? I say yes. I will convene to make sure. But I have not seen anything in RFA that says they cannot.
No, that is correct, Jeanette.
That's what I thought. What are the narrative sections for the LOI? The letter of intent. Were there narrative sections for the letter of intent? It was very short and to the point.
Yes, so there's one open answer area, but it's not expected to be a big narrative. It's just like, what are you thinking right now, kind of, and what target population are you thinking about? But I think one of those two questions is actually even optional. So again, it's mandatory, but it's non-binding. So it's very to the point. It's designed to be able to be taken care of in 5 minutes to submit your LOI. So even if you did answer something in the very short open answer question, you're not bound to that. You're only bound to what you end up submitting in your application.
Remember, mandatory.
Yes, go ahead.
Mandatory and non-binding. We want to make sure we keep that up front. So will the funding opportunity require a new project to be created, or is there the possibility to modify an existing program that already focuses on youth, behavioral, and mental health? That's a really good question. And I'm going to take that back to my group and make sure we get a distinct correct answer for you.
I will say that it's allowable to expand on an existing project. But again, we will have a more detailed answer. It doesn't have to all be a brand new thing that you're developing and creating. But there's a difference between expanding on existing work and just continuing to do the same kind of work. So we'll provide a more specific response to that question.
Thank you. We have a question concerning application. So it says, will only the lead organization and collaborative partnerships need to fill out the application and provide references and any other documentation? So I'm assuming you're asking if there's more than one organization that wants to be on this project. Does one person do the application, or is it kind of a multiple people thing? In this moment, I think it's set up for the one person.
Right.
And then you can
So
list your collaborative partners.
exactly. Yes. Yes.
So it says, if you already work with a vendor for your social media education campaigns, can funding be requested for that vendor? If you already have a great vendor in a relationship, that's amazing. Kudos to you. But I would assume in your budget justification, you will list your vendor and your explanation as to why and who this particular vendor is, and then what you would need them for this particular campaign. It's safe to say that particular vendor or this funding could not fund other things that the vendor is already doing, just this particular campaign. Is there an annual convening year one? And will the convenings all be held in the same place?
I can answer that question.
Thank you.
So, according to the budget, the annual convening will technically be in year 2 because it is in fall of 2024. So the year 1, based on the budget, ends in June of 2024. But in the first full year of this project, there is an annual convening. So that annual convening will be in the fall of 2024. All the convenings we're hoping to actually have it in different locations. So the first one will likely be in Sacramento, but just to be fair to all the different CBOs, we were hoping to have one in the LA area and one in the Central Valley. And that way we can see representation from of the different CBOs that we hope to have and communities.
Thank you. We had a couple of questions concerning that, so we addressed a few folks. So what are not allowable expenses on the budget? Food, refreshment examples for your youth focus groups and your youth workshops. We can definitely go into a little bit more detail concerning this question, and we'll put it on the Q&A so that you can have kind of some better ideas.
Yes, and there's a list of what's not. Oh, I see. Okay, yes, we'll provide that. Sorry.
Yes. Can you provide services in multiple counties in California? Good question. I know one of the things about the RFA is capacity. You have the capacity and you can justify that, put that in your RFA. There's nothing in your RFA that says you cannot. And then we want to know if school districts qualify. That's a good question as well. I will have to find out about school districts. We'll definitely get back with that answer. Last couple of them. Is there $1 million max over the total period, 2023 to 2026? And if so, is there a recommended breakdown of this amount per year? I think we should put that one in our Q&A for sure.
But the 1 million max is over the entire 27 months.
There you go.
Of the performance period.
27 months. One application per agency, we addressed that. To serve BIPOC, immigrants, and refugee communities, it is really not culturally competent to frame a project that serves children and youth without serving families and caregivers. Thank you for that. I think the target is youth. It does not include their families or caregivers. As we all know, youth have their families and their caregivers. So it is to include them as well. The target audience may not be them, but they will be included. Clarify what a collaborative partnership entails for eligible applicants. Do we want to answer that one live, or we going to put it in our FAQ?
We'll put it in the FAQ.
Okay.
Yeah.
We have the CDPH email has been listed in here. Talked about annual convenings. Does the state consider a particular population, okay, or is that not a priority population for this opportunity? The Arabs and the MENA. I don't want to pronounce it wrong. So
Middle
please correct me.
Eastern, North African population.
Perfect. Is that a priority population? We will answer that in our FAQ. We talked about convenings. I think so far we have hit everybody.
And
Is
Jeanette,
there? Yes.
I just wanted to, there have been a few questions about the office hour links, and
Yes.
I responded to them in the
Yes.
Q&A. So if you scroll down, I think currently the final question that's been answered in the Q&A, it has a link to sign up for the office hours on December 14th. So
Yes.
if people are having issues clicking that link, please let me know so that we can make sure to follow up in addition. But I do have that link in there a couple of times. So hopefully you are able to click that and sign up for a 20-minute slot. And Jeanette, I know you're going to actually get into that a little bit in the wrap up in just a moment.
Yes. We will definitely go through that again, but thank you, Emily. So you do have your Q&A, you have your answer. If you go into your answered questions section, you will see a lot of the links posted. I think something that was just popped up in the questions section. Let's see. Emily's currently answering that one. Okay. So is this in this grant, do you have a budget to support families for things like rent, school supplies, living expenses, and so on? We will answer that in our FAQ to go into a little bit more detail for you. And then we have Emily currently answering the question presented by Laurel. And thank you. We hope that we're getting everybody's questions answered. And we hope that we get them all answered in the FAQ, that we can go into a little bit more detail for folks so you can have more than we can definitely handle in this moment right now. All right. If nothing else has popped up on FAQ on the question and answer period, we can definitely go to the next slide. So wrap up. We have come to an end and we are almost ready to close out. We appreciate everyone for posting their questions. Everyone who helped in the background getting those answers together. Thank you all. And we'll go into our next step. So next slide, please. Reminder, the Q&A and the webinar section will be posted on the website by December 14th, 2024. That website link has been posted in the answered questions section, and everybody can go there as well. Next slide, please. Couple of application timeline announcements that we just want to reiterate to everyone. So today was our informational webinar. We will have office hours on December 14th, 2023. The link is posted in the answered section of the Q&A. The letter of intent, which is mandatory but non-binding, is due on December 18th. We will have a second set of office hours on January 5th. That link will be posted on the website once it's ready to go and you can start signing up. Don't forget, the RFA deadline is January 16th, 2024, 2 p.m. Pacific Standard Time. It can be submitted in the portal. Letter of intent also submitted in the portal. We will do an application review period, January 22nd through February 2nd, and the award notification will be no later than February 15th, 2024. We do have our email address listed in the answered question. We have the website listed in the answered question section and the link for office hours in the answered question section. So please click on those links. They are available to you. We will update the informational webinar will be posted. Frequently asked questions will be posted, and we will keep a running tab on those frequently asked questions to keep them updated as they come in. Next slide, please. All right, next steps. Don't forget to schedule your office hours. If you have questions, you need some more input, you need some more help, office hours are available. You are able to sign up for 20-minute increments on Thursday, December 14th. It will give you an opportunity to ask questions, get some more detailed, anything that you need in that space. Don't forget our Q&A document will be updated continuously with these questions. Letter of intent, December 18th, 2023 by 5 p.m. You can submit that in the portal. And you can also share this opportunity. So please, the link to the RFA has been posted. You can share that with other folks that you may know that may be interested as well. Next slide, please. And I'm going to hand it over to Erica. Thank you.
Great, thank you so much, Jeanette. And this concludes our informational webinar. So we thank you very much for taking the time to join us, to learn about this opportunity. We are so excited about this, and we look forward to reading all of your applications and learning about fabulous ideas for targeting all the different local communities throughout the state. So again, Jeanette in her wrap-up provided all the key dates. All of this is also posted on the RFA website. There's also an email address, as she said. So please reach out to us and take advantage of the office hours that we'll be holding 2 times. So thanks, everyone, and have a great day.